Coordinated School Health does connect the dots. Coordinated School Health is an effective, coordinated approach that connects health with learning through 8 interrelated components. And I'd just like to touch on those briefly because, to be honest, they've been touched on all day. The first is health education, and you've heard throughout the day that we need to be teaching mental health literacy to our students and our staff, and we do have statewide K-12 health education standards that have a mental health component for all of our students. Health services is school nurses. It is the healthcare procedures that are provided to our students, both chronic health conditions and acute health conditions. Then physical education and physical activity. Physical activity is important for all of our mental health. We need to move. Movement is medicine, and our students need to move throughout the day, but we need to move as adults for our mental health and our physical health. Nutrition is so important. I really love one of the opening panelists talked about food insecurity. I made my own notes from what she said, but love that Director Sparkman said that one of our students couldn't eat in the cafeteria and now he's able to. Nutrition is so important to our students' overall health. Staff wellness is another component, and we've touched on that today. We not only want our staff in our schools and in our district office to be mentally healthy, but we want them to be good role models for our students. Another component is student, family, and community involvement. I love how student voice has been elevated with our students at the podium sharing today, but throughout the panels, and I know you're going to hear a little bit more about that. It's so important to get our student voice involved in their education, get their families involved, but community involvement with community partners that we're going to hear from here on this panel is so important. Safe and healthy school environment. That is school safety, but that is also bullying prevention and school climate that are so important. Again, I want to give some praise to Director Sparkman because she talked about how students, if they don't feel safe, they are going to have some anxiety and they're not going to be able to learn. But last and definitely not least, school counseling and psychological social services is a component that is mental health. And it's so important that we have school counselors, school psychologists, and school social workers in our schools to provide wraparound services along with school nurses for our students when they need them. I love what Laura just shared too about school nurses and the school nurse and her daughter. And I promise I haven't even talked to Laura, but she gave me a great segue because school nurses are sometimes the only person in the school that our students talk to. And in Tennessee, I'm very proud that we have been able to provide youth mental health first aid for staff, but for school nurses. So they do have that mental health literacy. And some members of our division are here today, and I told Jamie Grammer, who's sitting right over there at lunch, I'm going to give her a shout out because she drove from Jackson, Tennessee to Chattanooga, Tennessee to be a part of our team that provided youth mental health first aid on January 2nd to 120 school nurses in Chattanooga and Hamilton County schools. So we are doing that work, but today, as everyone has said, we're here to learn more about how we can continue the work. But coordinated school health supports our students, gives them the capacity to learn through those coordinated components. So let's continue connecting the dots here. I'm eager to discuss the programs that our panelists have and to learn more about the unique models that you all have to support student mental health. They're going to share insights on fostering a culture of understanding and support within educational settings, not just K-12, but higher ed, ensuring that our students have access to the resources they need to thrive not only emotionally, but academically. And so we're going to dive into the strategies for promoting mental health awareness, reducing stigma that we've already heard about today, but expanding support for educators. So my first question is for each of you. We'll start with Dana and go down the line. Each of you play an important role in serving students at varying levels across K-12 and higher education, and you come to your work with unique programs and approaches. So to start us off here, if you'll each share about the mission of your organization, the role that you play in serving students, and then the ages of the students that you serve.
Thank you. So I feel like I represent Bridges. We're a little bit of an oddball in this mix because we are not a mental health institution, and we are not a K through 12 institution either. We're a youth serving organization, so I would consider us like beyond the classroom, right? We do offer workshops for folks to come to our facility during the school day as a field trip, but our core programming is with students who are coming from a wide array of 6 through 12 education environments. We recruit students from every type of school in the greater Memphis area. So we have students from 57 different zip codes and 130 different schools. And our mission is to unite and inspire diverse youth to become confident and courageous leaders who are committed to community transformation. So it's a mouthful. But basically what we're doing is every program we have is aligned to that mission. So it is about diversity appreciation, so bringing young people together, helping them to develop cultural competency, comfort, the ability to walk into a room with a group of people you've never met before and figure out, and to learn to build a really strong relationship, and then to develop leadership skills. So for us, that's, we use experiential learning to develop leadership skills. We have a ropes course in our building and a rock wall. So it's everything from just playing games or approaching challenges, trying to solve problems together, to actually doing physical challenges or having really courageous conversations. But in that work, we see students really develop the sort of resiliency that they need to overcome challenges. A lot of times I say students come for a week of programming with us and they just it'll just be like failure after failure after failure, like every group challenge they fail. But what they learn is how to support one another and how to build their relationships and their strength. And then finally, it is about community transformation. So we're saying we're building these great leaders, but it's not just so that they can go out and be the next CEOs and leaders of Fortune 500 companies. We want them to be, change makers for Memphis. We want them to be committed to our community, to making it better. And so we host a lot of conversations about issues that are affecting young people in Memphis and engage those youth in coming up with recommending and coming up with solutions to the issues young people are facing. That's why mental health is an issue that we've become interested in. Actually, it's our students who kind of brought us there. Starting in 2017, some of our youth leaders, through participatory action research that youth were leading across the district, raised mental health as the #1 concern amongst young people. So we had to pivot all of our programming towards that. We had to become advocates for that. We had to provide mental health counseling to our students because they asked for it. So that's really the space that we hold. And I think one of the things I'm excited about in this conversation is really connecting the dot to youth voice, because that young people are the missing ingredient to all of the interventions that we're working on. And we don't always realize that, maybe we know we've got the perfect best practice solution, but that isn't the right fit for that school or that neighborhood. And a young person could so quickly tell you what would work. And you can make that tweak and the effectiveness would just go up. And we see that over and over and over again in juvenile justice reform, mental health, education reform. Young people are stepping up and stepping into these conversations, and if we're courageous enough to listen, we'll see our investment of time and energy and resources will just get us a lot further. So thank you.
Thank you. John?
Well, thank you, and good afternoon to everyone. It's been a great pleasure to be here all day. The State Higher Education Executive Officers Association, or SHEO, is a policy membership organization. Our vision is higher education attainment for everyone in all 50 states, the District of Columbia, and U.S. territories. Our members are the chief higher education statewide and state system level leaders. And our mission is to support policy development, capacity, and advocacy at the state and federal levels for our members' higher education goals. My role is to coordinate the engagement of student success and state academic officer leaders and equity officers in support of this mission with our states. And that is why we have centered and prioritized the work of student mental health and wellness.
Thank you. Mary Kay?
Hi. Yeah, I'm just going to echo that it's been great being here today. Sandy Hook Promises mission is to educate and empower youth and the adults that work with them to prevent violence in schools, homes, and communities. In my role, I work directly right now with district leads and school leads to bring in our programming. We look at every school and district as to finding out exactly what they need and tailoring our delivery and our programs to meet that. Solving the problems that we're facing. I work with some state level partners, some district partners, and really looking at fostering those relationships and partnerships to make sure that they last. Our programming currently serves students in grades kindergarten through 12th grade, and again, the adults that are working with them there. And I also just wanted to add, so much of what other panelists have said today have resonated with me, especially when Senator Frisk mentioned that this is a day of hope. I think this hope is in our youth, so really just always paying attention to what they're telling us is so important. Thank you.
Thank you. You implemented with Bridges USA to address the diverse needs of students on an individual level.
Yeah, so, well, I would say, we work on mental health at every single level. So around, I guess it was in 2020, around when the pandemic started, we, like everyone else, it was like we knew this was a problem, but we couldn't turn away. It was like our phones were ringing off the hook with parents asking for help. Our students were contacting us. My staff was suffering, their children were suffering, so we were trying to figure out what to do. And we actually, we went to a local foundation, the Assisi Foundation in Memphis, and asked for some multi-year support to really look closely at how we could dial up mental health support in our organization, and gratefully they supported us. So we really tailored our programming individually, like our individual programming towards students around mental health. So workshops on anti-bullying, belonging, just around bringing students together and helping them connect to one another. We did mental health education days. We connected parents to, through actually Tennessee state-funded mental health first aid courses. I mean, everything we could do, we started sending it out. And so that was just to try to literally help our individual students. Then we also realized that there was a lack of access to mental health care services, and because everyone was asking for a counselor and we could not find any. So we connected every student. We serve about 5,000 students a year. We got funding to serve any person that showed up and needed help. We connected them with a counselor immediately, and they could get those 5 initial sessions, no diagnosis required, nothing, and then get referred out from there. So that was just like barrier-free, as quick as possible. We also, the majority of our students really reflect the city of Memphis and Shelby County, so the majority of our students are BIPOC students, Black and brown students, and so we wanted to make sure that we had counselors that looked like them and that could relate to their lived experiences. Everything was over telehealth at the time, so we were really trying to dial that up, and we partnered with the University of Memphis to augment that as well. And then finally, we really wanted to create a culture of advocacy around mental health, because we realized that it wasn't just enough to serve the youth that were at Bridges, or it wasn't just enough to those 5,000 youth, that there's 150,000 youth in that demographic in Memphis. And so we started a coalition for mental health, which was sort of I jokingly say we accidentally started a coalition for mental health because we heard the Tennessee CARES money was coming out and we didn't know what the limitations were going to be on it. And we thought, well, what if we could get millions of dollars to help young people? Let's bring everybody together and prepare. And so we started meeting, and then when the criteria came out, we realized that wasn't really doable. But everyone in the room realized that we needed to keep talking. And so we had 50 organizations, 100 individuals. So major hospitals, Methodist, Le Bonheur, Baptist, the school districts, we had youth serving organizations, Alliance, all of the major mental health service providers, all meeting regularly and identifying a framework that we could work on as a community. And then we got into committees and started doing that work together. And eventually we went to our county commission and asked for the commission to put public dollars behind some of the gaps that we had actually identified across this continuum that we started looking at, which actually I felt really grateful in that first session. It seemed like everything that we had come up with, it wasn't not data driven. It wasn't like we weren't looking at it, but really it was very much things that come out of grassroots experiences, like things like all of the youth services providers saying, I need mental health providers to work with the students, and then literally saying, who has space in their programs, and everyone raising their hand and saying we have space. So we're like, wait a second, is this really an issue of there's not enough therapists, or is this an issue of we're not connecting the therapist to the youth, right? And so we started to identify that there were some gaps in places that we needed to do more work. So that was really exciting. And I'm really interested in, and also all of those conversations were led by young people. So youth were driving the conversations, and they just looked and felt very different. Adults are really hesitant to say, oh, we don't have the resources for that, or we can't do that, to a young person who's saying, my friends and I, we need this. And so it really changed the dynamic, and I also kept, the hope factor was really dialed up. And I think that collaborative impact approach of getting all the players in the table and working together and identifying these opportunities to change and tweak things and centering the voices of young people is what the next iteration of all of this work really could look like.
Can you talk a little bit more about the importance of the community's involvement in all that success?
I think, we went and we were able to get additional funding for the program, for what we wanted to do. So, it's not a lot. It's like $1.2 million a year, but that's significant. And it was the first time that the county had actually put public dollars behind mental health for young people. And so what we're seeing, I think it also we built a ton of relationships. Mm-hmm. And, in our actual proposal that we took to the county, we really didn't talk about schools. And the reason was, it wasn't because we didn't want to help with the schools, it was because actually there was so much good work happening within our schools that we realized that we needed to put more emphasis on the community understanding what the opportunities were, and making sure that we were connecting the dots and filling gaps. And so I think that, I don't know, what's the most important role of the community? We got things done mm-hmm. that none of us could have gotten done alone. Mm-hmm. We took a lot of individual pieces of work that were working well and realized that it was in the collaboration between those pieces that things were breaking down. Mm. So it's like dialing up the impact, right? And that only happens when you build collaboration. Mm-hmm. This is really anecdotal, but it's really actually awesome. So many of the young people who have been working on mental health at Bridges, and there are dozens of young people, and I don't mean just youth being a part of things, youth being a part of leadership of things, mm-hmm. are now becoming social workers. They're now studying psychology. Mm. They're now studying public health. And that is amazing, mm-hmm. right? Mm-hmm. And not only that, they're going and they're getting these amazing scholarships to do it, because look at their resume. Mm. Oh, during the pandemic, I was a part of this, citywide coalition for youth mental health. And we raised money and got policies changed, and I worked with all these healthcare providers. What an amazing experience, right? So I just think if we think about how we include young people as a benefit for us, but also a tremendous benefit for them. And I think a lot of what I heard across all the speakers was also talking about just like hopefulness mm-hmm. and purpose and belonging, and tackling the hard challenges we have as a community together. Help us be honest. It helps us be effective, and it helps us accomplish the goal of, helping young people figure out what they're passionate about and getting, pursuing post-secondary education and being successful at it. So there's just so many reasons for communities to come together and do this kind of collective impact work that centers young people.
Awesome. Thank you for sharing that. Daren, I'm going to jump down to you. Could you share insights into Valor Collegiate Academy's Compass model and how it serves a comprehensive framework for supporting student well-being with all of us?
Sure. So our Compass model is our version of a comprehensive human development model, which is really just our way of thinking about humans holistically. It's a body, mind, heart, spirit model. And our kind of basic emphasis at the school was really recognizing that we all have inner work to do as well as outer work or academic work, and just helping foster a community where people are developing themselves holistically. And I think, so that's one part. This Compass model is like a big theme. But I think one of the, if I was to say, a foundational kind of mental health approach we take is just recognizing that we're deeply social creatures, and that our relational interconnectedness is the foundation. If there's one antidote to mental illness, it's connection with other adults or with other human beings, and kind of like being connected. And so we've worked to create what we call a relationship-based culture, and built a lot of systems within the school to kind of put people in relationship with each other. And so our students are all in mentor groups, which is kind of an advisory program, and we really have mentors, teachers who are also their mentors and are really designed to like be in relationship with them. They're in mentor groups for several years, and with this, they start every day with that same group and are just trying to foster interconnectedness and strong relationships there. We have a central practice that both adults and students do every week that we've gotten a lot of attention for, which is called our circle practice, but at its core, it is what is it Lori who just spoke about the movie? But it's a check-in practice, really. You check in every week about how you're doing, and it creates kind of a culture of vulnerability and connection. And adults do it and students do it as well. In our classrooms, we really put an emphasis with teachers on the importance of affirming students. And so people find it surprising, but we walk through classrooms every week, and one of the things you'll be scored on as a teacher is we watch the series of interactions that you have with students and score them as affirmative or as affirming or not, and really that all interactions can be affirming with students. And so we really just create a culture of affirmation. We track data on positivity ratio, which is really the recognition that all students, especially ones that are struggling, probably have negative stories about themselves, and it's our role to really tell them a different story as a school and as adults. And so trying to flip that into a new narrative for young people. And so we do a lot of kind of more foundational things at that level. And then we do some tier 2 and regular tier 2 and tier 3 type of things at schools. We have Compass counselors, we have coaches, we do a lot of restorative discipline work with kids. But for the interest of time, I'll pause there because there's some things.
I understand. Thank you for sharing that. I just want to follow up with you, though, Daren, on chronic absenteeism. We know that's a huge challenge for our schools and our school districts, but it does have an impact on mental health. And so what strategies has Valor Collegiate Academies used to support engagement and attendance for students?
Yeah, I'm sure everybody in this room has been tracking and is well aware of the chronic absenteeism crisis that we're in, and that school is really feeling optional at certain levels for a lot of schools, a lot of kids and families. We've also, post-pandemic, seen a rise in chronic absenteeism. So we've tried a lot of different things, and I think you're right that mental health is one of the components that can contribute to that. We use some of our ESSER money to create what we call a Compass Care team or program, which is a team at our schools of 5 people that we call family partners, and we match them with the students and families that have the highest chronic absenteeism rates in our school. And then they partner with the family and actually go into the community and kind of break that barrier of school and family, sit at the dinner table with the family and really kind of come up with an action plan, trying to understand what are the barriers that are getting in the way of the young person or the family making it to school. But usually all kinds of things come up. It could be the student is having to work because the dad lost his job. It could be that there are real mental health issues, that they're stuck in bed with anxiety. There could be things with the family, instability, moving. There's all kinds of things will come up, but if you have part of the school and the family partnering with them to solve those problems, create an action step, it does create hope for families, and we've seen great success. We've cut chronic absenteeism in half for the families that get enrolled in that program, which has been great. And we just applied for an EIR grant and got a federal EIR grant to kind of start sharing that program. But funding is that'll be my answer at the end about funding here in Tennessee. How do you fund those things? But it's an exciting program and a major problem. Yeah.
Sounds like you've been successful, so thanks for sharing that with us. Mary Kay, can you share about Sandy Hook? Sandy Hook promises educational programs, including Know the Signs program, which are Say Something and Start with Hello, and how these programs support student mental health and the work to prevent school violence and other harmful acts.
Sure, thank you. I'm also recognizing that we have the luck to follow lunch, so thank you everybody for hanging in there. So our two foundational programs are Start with Hello and Say Something. And if you were to look at them face value, they are simple. They are simple ideas. They're not, new ideas. But in that, they can kind of be tailored. And I'm going to go off my script here a little bit to say, Start with Hello is a program about social inclusion. What does isolation look like? Different ways for students to reach out and help each other. And something we help schools with a lot is chronic absenteeism. And in just encouraging students to look out for each other, a school will ask students, encourage your friends to come to school. Student leaders will do special activities, and students that are there are getting things. So a program called Start with Hello is actually helping students come to school. A little more on these programs. They are age appropriate. They're broken down by grade. Again, right now we're serving grades kindergarten through 12th grade. And they're both focused on teaching youth how to minimize social isolation, empathize with each other, and create more connected and safer school climates. So Start with Hello does look at teaching students how to recognize social isolation, someone who may be feeling pushed out by their peers or pulling back on them their own, and then how to reach out and help those peers. Anybody that may be feeling isolated or lonely, and then just ways and ideas to grow more connective communities. That's what Start with Hello is about. Our Say Something program is the one that is teaching students to recognize warning signs of someone that may be thinking of hurting themselves or others. By teaching them these signs, they can be upstanders. They know that they can say something to an adult that they trust to get someone help. In this program, we talk a lot about the difference between tattling or snitching on someone where your goal is to get someone in trouble versus saying something where your goal is to get someone help. The 3 steps of our Say Something program are recognize warning signs and threats of someone that may be thinking of hurting themselves or others, saying something to an adult that you trust to get help, and then growing a community of upstanders who look out for each other. Once students are trained in our programs, we offer sustainability, and that mostly comes from youth-led clubs. And when you empower youth to actually take charge and do something and plan around the violence that's happening in their schools, they really take it and run with it. They so want their voices to be heard. So we do that through SAVE Promise Clubs. SAVE stands for Students Against Violence Everywhere. This is an organization that's been around for more than 30 years. It started in the state of North Carolina. It grew from there and came under Sandy Hook Promise's umbrella about 6 years ago, I believe. Through SAVE, we do youth leadership training. We have annual summits. Those students have an opportunity to apply to be on the youth advisory board, where if they're interested, they might be acting in our training videos. They might be speaking at Congress if they're interested in policy. Also looks really good on their resumes, but really just focused on empowering those youth. And at Sandy Hook Promise, we do believe that combining that comprehensive upstream violence prevention with traditional school safety measures is the most effective way to prevent school shootings and other forms of violence. And when we talk about upstream, and just like Dr. Harvey mentioned, like what's in the well, like what is up here that is actually trickling down to everybody. That's why we want to give educators tools and curriculum. We want to talk about having flexible training options for schools, again, meeting schools at where they are. Schools can, any school, I mean, we're an organization that's based in Newtown, Connecticut, but we're nationwide. So I'm not here in Tennessee, but everything I'm talking about is available to you. We have a very comprehensive learning management system with a digital library, lots of different ways to get the training from us. And we know that when we do a lot of train the trainer models, so we're training the educators who are then going to turnkey that training to students. And we know that when you do that and everybody feels empowered, it's just a really effective way to have those programs become part of the school climate for years and years.
Awesome. You talked a little bit about the training and resources that you have, but can you share with us how you're able to deliver that at no cost? You know, Daren brought up funding, so can you share how you all are able to do that at no cost?
Yeah, first of all, we have amazing donors. And second of all, we've just, figured out a platform where it doesn't cost money for someone to go to your website and be able to pull down lesson plans, activities, all of that. It's there for everybody. We do work with grants. That's been a big part of my job for the last 5 years. I'm not sure if anybody here is familiar with STOP grants, but that is a federal bill that went through in 2018, and it allowed for a single school, a district, a county, a whole state to apply to bring in violence prevention programming. And in 2018, we were shocked by how many people reached out and wanted to use Sandy Hook Promise programming for that grant. That grant work is meant to be 3 years. It was extended over the pandemic, and we're just wrapping up some of that and starting some new grant as well. So there's granting opportunities. We just find a way to make it work. If a district reaches out and they don't have a grant, we'll try to work around a partnership. Maybe there's an individual donor who wants to do something in a certain area. We just really we're flexible.
Thank you. Okay, John, will you share about the new learning community among state higher education leaders committed to implementing whole student support for mental health that you're leading at your association?
Sure. In the fall of 2023, SHIO and the JED Foundation welcomed 5 states into our inaugural student mental health and wellness learning community. So Dr. Okolo, who shared this morning from the JED Foundation, and her team, as well as members of Team SHIO, we've had a wonderful collaborative relationship for the past 2 years that has culminated in this learning community, and we anticipate it will just continue to provide that support. So with support from Lumina Foundation, we awarded grants to Arizona, Louisiana, Oregon, Pennsylvania, and Texas through a competitive process. And for a year and a half, we will focus on the development of recommendations and policies and practices that participating state higher education agencies and systems can make to collaborate with institutions to support student mental health and wellness better. Sustainable practices have the potential to turn into scale for our full membership. And because minoritized populations have had challenges to access to services historically, our project priority is to cultivate an awareness about this that can lead to improvements in availability to them. State higher education leaders nationwide, of course, work to improve attainment rates of post-secondary credentials. So making academic progress in college every year is essential. Yet, to emphasize a point that Dr. Okolo made this morning, Year over year, more than 70% of students surveyed who stop out of college or are seriously considering stop out cite challenges to their mental health and wellness as the number one reason they do, and the number one reason by far. So a primary objective of the project for states to support institutions better is to cultivate centering student mental health specifically as an academic affairs issue, because with data like this, students have in fact already. We don't want new practices to perpetuate the current circumstances of under-resourced student services and counseling centers as a second area of technical assistance in the learning community. In addition to these 2 points, I'll cite some that we brought into the project and other that we have learned since we began this past fall. We want to onboard academic affairs resources campus-wide in a way that cultivates a systemness that is statewide, empowering faculty but striking the right balance so more responsibilities for faculty aren't simply piled on. Our learning community is exploring better campus-wide campaigns of student and faculty self-care that destigmatize conversations and recognize faculty and staff need to better support themselves, in addition to some of the other opportunities. Reducing counseling center appointment wait time significantly from months to days or even immediately has been another finding. As we sort out the vocabulary that was cited in the previous session so well, this also helps to continue to refine the responses and, as a result, the strategies that states can provide to the institutions that they serve. And last, to take advantage of peer state examples. There are exemplary programs, initiatives, and policies in Oregon, in Minnesota, Louisiana, New York, Tennessee, and Kentucky. So there's much being done and, of course, much more to do, but we're really enthused about the opportunity for this to be an iterative process so that even as program activities cease at the end of this calendar year, this work will be able to continue in other programmatic ways.
Thank you so much. I've been given the signal that we need to wrap up. I could sit here all day and listen and ask more questions, but very briefly, I want each of you to just tell us, summarize what you think the next big steps are for our state to promote positive mental health for our students. So Daren, I'll start with you and we'll just briefly go down the line, if you can.
Well, I think the maximizing funding streams, I think that if you just look at the curves of the mental health crisis going up, that we're going to need to either reallocate or kind of get funding in places for education. I came from a state that was significantly better funded, and so it's just interesting to feel the difference in a school in terms of like what we are able to put in our school versus what other states are able to put in their schools. Yeah.
Thank you. Okay.
I think I'd have to answer that question by saying to keep empowering your youth. Their voices are strong, and like Dana said, they can often get to a solution faster than anyone. And I just wanted to share, we do have a flyer down there. This QR code takes you to one of my colleagues' contact information if you wanted to email for any more information. But quickly, Senator Frisk also mentioned this morning that this is a teachable moment here, and I think for that really to have the biggest impact is to all have teachable spirits, because we do know when, wait, I wrote this down, it was so good. We do know that when students feel valued, safe, and connected to their school communities, they are better and more likely to thrive academically and socially. So it really is looking at the whole student.
Absolutely. John?
Building broad coalitions where everyone can take ownership, centering student voices, and then leaning into just design. So I really want to affirm that the effectiveness of the model of centering student voices is beyond them simply telling their narratives in the first person. but to support some points that were made just moments ago and throughout the day, enabling students with that sense of agency so that they are received as equal thought partners and thought leaders who continue in the conversation in that deliberative policymaking context is very valuable to our work. And then second, just to emphasize leaning into just design. If the work of equity can be time-stamped, then equity work now is meant to mitigate disparities that result from circumstances and conditions that were implemented in the past. And just design raises the question that if we, or points to a solution such that if we have new solutions but don't address base systemic conditions, then the new solutions will only perpetuate conditions. But if we look at justly designing the circumstances, then we can provide a space or incubator for new solutions so that we have less equity work to do in the future to begin with. So it's really important to lean into that so that this work is sustainable and scalable.
Thank you. Dana?
Well, co-sign all of that. The only thing I would say is that young people are experts in their lived experiences. And so including them when not just trying to get input and then, saying we ask students, but co-designers, co-creators, co-leaders, co-evaluators, co-researchers. That paradigm shift, I think, would get us the best result. It would really change things profoundly. And if I can just lob one out there, what I would really love to see in Tennessee is us to look at really strengthening peer support models. And Sandy Hook has some things they can offer. But if young people in a mental health crisis often turn to a friend first. So if every young person in every middle and every high school knew how to question and persuade and refer, or could provide some support, that would stop a lot or provide a lot of connections early on. Of course, all the other things, there's no silver bullet. Everything else has to be in place as well. But I would love to see more young people as partners in this journey with us.
That was wonderful. Thank you all. We've learned a lot from you today.
Thank you.